Okay, we are back. Our next presenter is coming on board. Trent Jefferies, are you ready?
Trent Jefferies. I'm the CEO of VendorX. We are a company that is innovating the prescription experience. When we look at the prescription experience, we like to think in terms of lateral thinking. I don't know how many of you have done lateral thinking puzzles that requires looking at problems in a different angle or in a different way. So as an example, I'll give you a quick little thing to let your mind churn on. There is a man that lives on the 10th floor. Every day he takes the elevator down to the first floor. And then at the end of the day, he comes up and he goes to the 7th floor, gets out and walks up the last 3 floors to go home. He hates walking. Why does he do that? So that's an example of a lateral thinking puzzle. I'm not going to give you the answer. If you happen to know it, don't share it with your neighbors. You can think through that a little bit. But the reason why we like that thinking is because lateral thinking forces us to look at things in a different way. And the key problem, which we're trying to address, requires that. The prescription fulfillment landscape is extremely difficult to navigate. And as I'll highlight in a moment, the impact of some of the statistics make it very problematic. Traditionally right now, getting the prescription is divided between providers and pharmacy. And there's this huge gap that the patients fall into. Let me give you some statistics to give you a feel for the complexity of what they have to navigate to show the impact on this problem. And many of you may have heard some of these. Up to 1 out of 3 new prescriptions are abandoned. In some cases, emergency room settings in particular, that could be as high as 1 out of 2. Approximately 100 million Americans lack good access to pharmacies. We call that pharmacy deserts, and you'll hear that term occasionally throughout this presentation. 50% of providers advise their patients to price shop. That automatically implies that the patients don't know where to get it at the best cost, and neither do the providers. 54% of patients under 65 are paying out of pocket, meaning they're paying cash. Prescription prices can vary by as much as 10 times between pharmacies within the same city. Keep in mind that's the same drug going to a variety of pharmacies, 10 times price variation. The average American spends $1,200 per year on a prescription drug, $100 a month. 69% of patients, when picking up a prescription, found it was more expensive than they expected. And 28% of pre-Medicare age adults aren't adhering to their prescriptions as written due to high medication costs. So we look at these different statistics as we outline this problem of getting the prescription, and we like to term that as prescription fulfillment friction, and it's embedded in the process. So what's the solution to this? Again, we highlighted this idea of lateral thinking, looking at things in a different way. We like this little tagline: give them their medication instead of just a prescription. We know that patients like 2 things right up front. They want convenience and they want best cost. And so if you're able to address one or both of those in a manner that meets their needs, you're able to address a lot of this friction. Our platform is, we have a variety of solutions in there. And the first one, as you can see, is automation. We have an automation solution, hence our name, VendorX. We're able to dispense direct to a patient. We're able to do that either in a physician's office or as a remote pharmacy. We're tied to the cloud, so it's very scalable. And we also tie into the patient's phone. In tying into the phone, we're able to enable growing patient behavior and needs to utilize their phone or their desires to utilize the phone. As mentioned, we're able to tie in with a pharmacist that can be remote from that. So you can place that box, that steel box that dispenses, in a variety of locations. Those locations can be high density locations where they need after hour support, or as I've mentioned before, pharmacy deserts or remote locations. In this quick video here, you'll see this is what's fun about our system is it's patient facing. The patient's able to go direct to it and access it without any other labor. And that provides the opportunity to put that either, again, in a physician's office or as a remote pharmacy at another location. You can see the inside of the machine holds up to 500 bottles of medicine. They can be any variation of that. And when it's dispensed, it takes approximately, when a person goes up, takes approximately 1 minute for them to get their medication. this particular video is showing the simplicity of how to get the prescription into the system. There's two ways to get into the system. One is through the EMR. The physician simply sends it to themselves, for lack of a better description, and it's in the cloud that allows the patient to be able to get their prescription. The software here also is a means to be able to send it through a portal. So those that don't use an EMR want a simpler way can do that. And it takes about 30 seconds to put it in. This particular workflow you're going to see in a moment enables this to be sent direct to a patient on their phone. So as soon as that is input and prescribed, or as soon as it comes from the EMR, it immediately goes to the patient as a text link. When they have that text link, at that point in time, they'll have two choices. They can either pick it up at pick it up at their doctor's office, or if they're there in the doctor's office, go to the staff immediately, or they can have it mailed to them by the office. They're able to pay for it directly on the phone, and they have their receipt and their patient information sheet, which is provided electronically or via email. And so this is a way we're able to simplify the process so you don't have to tie up the labor content, nor do you have to change your workflow in your process. Now, what we're really excited about is what's coming next. We call this Route My RX. It takes the phone one step further. It allows the patient not only to have the two choices, but we add to that additional information, such as what is my copay? Where are the best costs around me? Or are there coupons that I can leverage? And we give them that choice. We then want to be able to provide this as a free service to providers so they can send this to their patients and allow their patients to immediately use their phones to streamline the workflow, to eliminate that conversation that the provider has to have that oftentimes they don't have the answers to. And in that process, if they want, they can also dispense and be able to provide a greater convenience to the patient and also make some additional revenue in that process. We like to look at use cases, and we break it into two scenarios, and that's generally governed by the laws that exist in the jurisdiction of those laws. And so the first use case we look at is physician dispense. Over 45 states now have favorable laws that allow physicians to dispense direct to their patients. And if you look at examples of that, it's an ideal place for employer locations that have on-site providers, concierge or direct primary care providers, which is a growing market, urgent care settings, specialty practices, or especially for accountable care organizations because of the cost savings by dispensing direct to the patient in the office. As we look at the other segment of use cases, we're looking at remote pharmacy. It's connected to a pharmacist directly. And so from a remote location, that pharmacist can then provide the DUR, the consultation, and any adjudication that's required. And they can manage up to several locations. In California, as an example, they can manage up to 15 sites. It's ideal for emergency room settings or outpatient settings, rather, elderly care settings, isolated communities, or after hours in retail pharmacies. Again, this is a pharmacy system that's remote, connected with a pharmacist, versus the other use case is a physician dispense in their office. The physician dispense in the office can be both automated or can be just a software solution that facilitates manually dispensing, either scenario. What we've really liked, it's been kind of fun as we've talked to people here in the conference, is that as we explain the concept, all of a sudden everyone's mind starts going, well, hey, what about this? Or what about there? Could you use it this? And absolutely, because it's a tool, and like any tool, can be appropriately used in a lot of places. And we love the feedback that we've been getting on that. From a business standpoint, VendorX, we have been around for a few years. We have 4 patents that have been issued. We are in revenue. We have customer traction. In fact, we just installed a 3rd site last week, and this week we're getting some new sites going up with a major mental health care network. We also have multiple scalable relationships to be able to facilitate growth. As we go forward, we're opening up a new round to facilitate the finalization of the Route My RX tool, which we expect to come out early next year, increase our sales growth, and more importantly, this round is going to position us for a Series A growth round. That's all I have for now, subject to any questions. And if you have any interest from an investment standpoint, by all means, please feel free to contact us. And any questions on our solution?
That was great. Thank you. I just have a couple of logistical kind of questions. So you The centers would purchase the machine in addition to the medications. Like if like one of these mental health centers that you're partnering with, they would, if you put a VendRx machine in, would they also be purchasing wholesale or they would be purchasing the medications as well?
Yeah, great question. So the items or the stock that goes into it, we have relationships with multiple suppliers, and we're one of the few that can leverage pharmacy wholesalers. Yes, they would then purchase, we facilitate, and part of our system, the software or the hardware, the back-end system, it's an inventory control, management, and ordering system, as well as a dispensing system. So we have automated, once the formulary is established, we automatic order that product, and then it shows up at the location. They're able to receive it at that point in time. So the system recognizes it and manage the dispensing. And so it's all automated from a software standpoint. And yes, we connect to a variety of suppliers, or if it's a pharmacy, they want to be their own supplier, great, they can do that as well. We're agnostic, if you will, from the supply chain standpoint.
The other question was just in terms of verification. You know, many times somebody else goes to the pharmacy to pick up a prescription on behalf of someone else, and you have to kind of sign and sometimes show an ID. If you're picking up a prescription, can anyone go to the machine? Like, how do they verify when the consumer goes to the machine?
Yeah, so it's when the machine and there's no labor interaction, it's very similar to what you do when you go to a pharmacy. And there are some, we triangulate it. That's part of our patent on there. They provide some personal data, and typically that is birth date and name and birth date. And then we match that, triangulate that with physical location, time, to be able to manage the security on that. And so, yes, it's very similar in the fact that they're providing some information that identifies them as the ability to get that prescription.
We have a question from the audience here in Santa Clara.
So this is more of a venture capital question, okay? So looking at the model, it's a position so as an investor, from an investor perspective, so you know you're raising $1 million, and I'm evaluating this as an investor. When I look at this, I see this as having high potential as an early acquisition target, as opposed to even a Series A or a Series B. So you look at this market, and in this market, there's Amazon, there's a lot of people in the pharmacy distribution market, or at least looking at it seriously. Who do you see as a potential acquisition target for you as a company?
That's a fun question, because obviously we have lots of fun conversations like that. As we look at the market, and just for a frame of reference, it's a 500 billion plus market, right? The numbers in the dispensing world are enormous. There's lots of players in that. We could go down the list of potential acquisition on that. Amazon, as an example, just entered the market. We look at their value proposition. Well, Amazon has great logistics. Well, guess what? You can't really leverage that logistics when you have a consolidated location. The FDA is governing on that. So they're just another player for distributing medicine. So how do you really get in there and have the doctors invite them in from a supply standpoint? So they would be an example. CVS would be another great example. You look at their balance sheet. Their balance sheet is heavy on real estate. Well, guess what? The whole world is changing when it comes to the behaviors of people and how they want to get their medication. And so how else do you be able to get your name out and then shift, still being able to provide medication in a different way, other than begin to reach and stretch into the physician office, where you can't beat convenience. There is no last mile. There is no, that friction goes away. So we envision that. There's also conversations that we've been having with grocers, because when they look at their particular, they actually.
I'll have to stop you there.
Yeah, so the list goes on.
Judges, any other questions before?
Can you quickly comment on your team and also how you plan on getting those additional partnerships and places to implement?
Yeah, from a team standpoint, our advisory board is composed of several physicians and several pharmacists. We believe that was important because we kind of bridge that gap. We also have some engineering expertise. Obviously, it's a piece of hardware, as well as software expertise on our core team. So we wanted to have a well-rounded team to be able to facilitate that. And I missed the last part of your question. Could you please repeat that?
It was related to you getting partnerships to implement your device and your solution.
Yeah.
You-
So partnerships in there. I'll give you an example of one. Direct Primary Care, DPC, hint.com is one of the largest software providers of DPC clinics. We have integrated with them. We have a partnership, and we're about to roll out with them as one example of leveraging that to be able to get into the increase our sales range.
So basically you have a sales team and you have your use cases and you are trying to contact those places at the use cases to implement your device, correct?
Absolutely. We don't want to both hire a sales force, if you will, nor do we want to go out there and do onesies and twosies and knock on doors. What we really want to be able to is reach into networks. And because as they see the value of that, once they see and experience that value, it expand from there. I mentioned the one that we're just starting up. That's a network of about 300 nationwide mental health clinics. We're initiating here in the Bay Area, and then from there it'll roll out. That's as an example.
Thank you.
Thank you.
Yeah.
Time is up. Let's get the judges to judge.